That's because I was muted. Thank you for joining us for this, the first of the 3 DBOT sort of summary webinars. If you're having any issues with the technology or with the or accessing us, please just drop us a note in the chat box. You should have a little chat box on the panel on your screen. You've got a hand up. If you've got an issue, just drop us a little note in the chat box, and my colleague Marie will pick that up. I'm going to get started. I'm sure people will join in sort of in the next 5 minutes, but as you are all lovely and on time, we shall get going. I'll just check that you can all hear me. Could you all just pop a yes in the chat box if this is coming through loud and clear? Excellent. Looks like this is working well. Okay, so welcome everyone to this, as I say, the first of the 3 DBOT webinars. My name is Philippa Watts. I'm Senior Programmes Officer for the Health Team here at CDC, and I'm joined by my colleagues Ryan and Marie, who are going to be sort of supporting on the slightly technical side of things. We are also joined by Helen Vincent from Luton, who is going to be speaking to us about their speech, language and communication needs JSNA a little bit later on in this session. I will let her introduce herself properly once. So it's a 1-hour webinar, which is just bringing together some of the learning that we've had from the DBOT contract this year. DBOT, if you're not familiar with it, stands for Delivering Better Outcomes Together. It is a Department for Education funded project which is delivered by consortiums including the Council for Disabled Children, NDTI, and led by Mott MacDonald. We have a few other partners who join in on various bits and pieces, such as Contact, looking at some parent-carer work, but we 3 are the primary members. So just as a just as a brief summary of what we've done over the year. So we have 5 different streams of work, and I will go over 3 of them with you now. The other 2 are sort of a little bit more internal. The first one is a series of regional workshops. Each of the 9 DFE regions have the opportunity to have a regional workshop or a bespoke alternative if they don't feel that a workshop is the right approach for them. We have a choice of 4 themes that we, and these have come out of previous years' work as key issues that people would like to work on. So these 4 themes this year have been aligning different programs, data and information sharing, personalization, and outcomes-based commissioning. So of the so far, we have delivered aligning different programs in a number of different areas, including the East Midlands, the Northwest, and the Southeast. We have done work on data with London and Yorkshire and Humberside, and the East of England have had a bespoke piece of work on JSNA analysis, which I'll come back to later and we'll share some of those results with you. If this is a surprise to you, if you are from an East of England authority and you weren't aware that we were doing this piece of work, then my apologies. It's been going for the last couple of weeks and we're just drawing our findings together now. I have a draft from which I've drawn the presentation, but I'll be sharing the sort of nice tidy version with Ian and Sheila relatively soon. We still have a couple more events still to come. We're delivering aligning different programs in the Northeast on the 4th of February and also the same day in the Southwest on the 17th of March. So if you are from one of those regions and you would like to attend, please do get in touch and we can point you in the right direction. I think you should have Marie's email address from having signed up for this. If not, I'll make sure you will get it at the end. So a very brief summary of what those days have looked like. I'll be focusing on the aligning different programs and the data and information, as actually nobody has taken us up on the other 2. So there's been an overview of the national context around joint working. So that's sharing some learning from various different reports, and pieces of work including review, the National Audit Officer report, the Select Committee report, exclusions, those kinds of things. We've then done a quick summary of what we mean by alignment. So it's a bit of a woolly term. People are never quite sure what it means, but for our purposes, we're talking about 4 key strategic change programs, and local authorities and local areas can bring those together and streamline their work, improving sort of efficiency. So we've been looking at the SEND reforms as the key element, that being the focus of the DBOT work, and how that can be aligned with personalisation, learning disability and autism, formerly known as transforming care, and the long-term plan. If this is something that you are interested in, we have a really useful resource, which, have I got it here? Yes, I have, which summarises the key elements of those 4 different change programmes and how those elements run across between the programme. Looking at is where can you kill 2 birds with 1 stone with that piece of work, and streamline and minimise duplication. I think I should be able to contact you all after this presentation, so I can share this resource with you, as it is quite a useful tool. So those have been the focus for the alignment day, and in talking around those, we've had a few different examples of case studies, looking at what alignment means to children, young people and their families when things are working in harmony and everything is come together, what difference that can make to their lives, some real life case studies there. And we've had a good practice example from the region, someone who's been working on various different aspects of those with success. Then there's been some discussion sessions, prioritising and action planning in local area groups or neighbourhood groups, where alignment can be accelerated forward based on the learning from the day. And then we've had a bit of a discussion about, are there ways that a regional approach can support this work, and to help others sort of carry forward together. So that's the Aligning Different Programmes Day, and as I said, I will share this with you. The Data and Information Days have been slightly different in London and in Yorkshire and Humberside, depending on the focus that they wanted. But again, it started out with that same overview of joint working at the national level. We've had some examples from inspection reports, how different local areas have been doing on information and data sharing. And I think the main thing that we've learned from this is that it's a real area of challenge. There are some pockets of good practice, but it's not easy. And I imagine that many of you have dialed in today because it's a struggle, and you're hoping that your JSNA work can support your data and vice versa. Again, we've had practice, drawing from the local area, and then a discussion sort of sharing different pieces of work going on between local areas. We did a presentation on the 0 to 25 SEND data dashboard. If you haven't come across this yet, this is a really, really useful tool, and certainly one JSNA work. It is designed to be a single source of truth for national data sets pertaining to the 0 to 25 SEND population. It's not new data, but it draws together the data that is readily accessible. At the moment, it's an Excel spreadsheet in different ways. If you haven't had a look at this, it really is very useful. And again, I will share a link to it, as it should support you in your JSNA work. We then, in the London event, had a look at the overlap between JSNA and high-level SEND outcomes and how these can support each other. And I'll come back to this as I'm going to share a few slides with you from that presentation. And then in the Yorkshire and Humberside, the emphasis was more on the practicalities of using that data to support your outcomes framework. And we had a lovely presentation from Leeds there about how they were doing that piece of work. Then again, similar to the previous, we had a prioritisation and action planning discussion section, and then looking at a regional approach. On the whole, from the regional events that we've delivered so far, we've learned a few key things. They look a lot like what we learned from last year. The picture hasn't changed dramatically, which I suppose is worrying in some regards and reassuring in others. We know there are pockets of good practice out there. we're finding them all the time. Every time we go to a local area, every time we go to a really, really great work, but others aren't hearing about it. There isn't really good sharing. People are a bit worried about shouting out about what's going well, or maybe a little uncertain that what they're doing is good practice. So we really do encourage you to be proactive in your sharing. You can contact us. We're always happy to write up a case study. We love a case study, and we can promote those through our channels. But do also share, on a local level and on a regional level. Find areas who are struggling with the same thing as you, or if you're doing something you think, yes, this is really making a difference, please do use your own channels to celebrate it and share your learning with others. We've heard quite a lot that relationships between different agencies are getting better. More people are getting multidisciplinary teams working well, getting more people around the table, and we're hearing that quite a lot, that picture is improving. Reforms have given some impetus to that, so that's really encouraging. And lots of different areas that we've worked with have been reviewing various pathways, a lot of work going on with neurodevelopmental diagnosis pathways, short breaks pathways, so there's a lot of really positive work underway. We also hear some really good examples of where visionary leadership has really made a cultural shift in the spirit of the SEND reforms, which has been very, very positive for children, young people and their families, but it still isn't happening everywhere. We still know that leadership is I think, really the foundation of these SEND reforms to pass in the way that we all hope they will do. I mentioned multidisciplinary teams already, but where they are in place, they're working really well, and the feedback from families is that they're telling their story less frequently, their children are getting better support and better outcomes. So please do continue to share your examples for others to learn from. So the picture is looking relatively good from that perspective. Of course, there are still a lot of challenges going on. These look very similar to last year. There are still lots of debates as to who's paying for what should come out from what budget. We know those aren't going to go away overnight, but we are hearing that the multidisciplinary approach and good joint commissioning is reducing those in many areas. We're still hearing that transition can be a cliff edge. A lot of people are saying it's different services involved. So even where joint working is working very well in the children's realm, not always having that connection with adults, and that's still proving a challenge. We hear quite a lot that there is a reluctance to take positive risks, where innovative ideas are being created. There's not always the impetus to follow those forwards, often because of the financial environment, as well as the concerns around the written statement of action that may or may not be received. That parental choice is still lacking quite often. Personal budgets, where they're working well, are really working well and are giving families a lot more control and feeling a lot more satisfied with the support that they're getting. But we do also hear that even when a personal budget has been agreed, there are limited options where that can be spent, so that the services aren't necessarily there to underpin that personal budget and still allow that choice. We're doing a piece of work with Sandwell around personal budgets, and a resource will be coming out of that to sort of share the learning from that journey. So do keep your eyes open for that if that is the kind of thing that you're looking for support with. We know that capacity and staff turnover is a massive issue. We hear the word churn a lot. I don't like it. It's a word that makes me feel slightly uncomfortable. But we know it's an issue at all levels, from the strategic levels down to the frontline staff. We particularly hear it around the HC plans, staff involved. So organisational memory is struggling as a result. The other one that we hear, and this is particularly relevant for the JSNA and data stuff that we're going to be talking about today, is infrastructure can be a barrier, particularly IT. To have good joint working, you do need good data sharing, and if the IT systems don't support that, then it can be a struggle. We've got some examples of places that have overcome that. Level 3 sharing agreements have been really helpful. We've got a case study from Camden about their alliance agreement which shows a really innovative and quite progressive use of data, which I can also signpost you to after this session. So a lot of challenges still out there, but there certainly are pockets where these challenges are being faced head on and overcome. So while you are no doubt facing many of these issues, you're not alone, and there are people who are doing some really nice work on overcoming them. So we will always share those examples where we can, but we don't know they're there unless somebody tells us. So if you're looking at this list thinking, no, we're doing some really, really great work around that particular issue, please do get in touch. We would love to hear from you. Of support that we've been offering through this contract is bespoke support. So this is 2 different pots of days. The first is 103 days for support to areas who have already had their SEND inspection and have been asked to write a written statement of action, and then 35 days for areas that haven't yet been inspected and haven't had a written statement of action asked of them. I should say now that most of these days have gone. We have a smattering left, but I'm already in conversations with a couple of areas who are fighting over the last few. So if you haven't been able to take this up this year, we are still waiting for confirmation of what the contract is looking like next year. But we are hopeful that there would be a similar offer next year, though that is no guarantee, and I can by no means promise it until we've had some further reassurances from DFE, but we will let you know when we know. So these days, as I say, are bespoke support. It's between 5 and 7 days of support for each local area that approaches us. They can be face-to-face delivery, desk-based activities, research, anything like that, whatever is needed to support with a particular joint working issue. Our strand is on joint working, so all of the work that we've done as part of this support area has been multi-agency, bringing people around the table to discuss particular issues that we're struggling with. Some of the things we've done so far have included developing high-level outcomes framework. So these are, you may be familiar with the Hertfordshire outcome bees, which I'll be honest, I meant to include in this slide set, but I've just realised that I haven't. So again, I can share that with you as well as some other examples. So these are the frameworks that say, what do we want life to look like for our children and young people, either those with SEND or a universal children and young people's outcome framework. They are quite straightforward, if I dare to say that. They tend to be just a list of things that make children live happy and fulfilling lives, and they're often the list that we would want to see for ourselves, our own children, our own families and friends. Things like to be safe, to be happy, to be healthy, that kind of thing. So we've been working with a number of local areas to develop those. The idea of those being that once you have that series of high-level outcome statements, you can then work your commissioning and tendering processes to align with those, to see how the services that you are delivering are contributing to high-level outcomes in children's lives, and also align with your EHC plans so that you can aggregate from the individual outcomes all the way up to those strategic outcomes. And where those are being done well, it gives us a whole picture that Ofsted want to see that you have that strategic oversight. So having a framework like that, you're looking at things from that strategic level. We will be doing another one of these webinars on this topic, either at the end of February or the end of March. I'm just working with Stockport to identify a date for those. We've been doing some really in-depth work with Stockport, developing not only their framework, implement it, so the next steps. So do keep an eye open for that as well if you're interested in learning more about those. The next most popular piece of delivery we've been doing is our EHC plans and outcomes training. So that's looking at outcomes at the individual level, thinking about children and young people want from their lives and how we represent those in the EHC plan. So looking at how aspirations tie through to outcomes and how service provision supports those outcomes, and how advice needs to be written to make sure that that holistic view of the child comes through in the EHC plan. Afternoon, where we review templates and processes in the local area to see if they are enabling the good practice around EHC plans, and if there's any improvements that could be made in that area. We've done a couple of neurodevelopmental diagnostic pathway reviews. We've done on an integrated pathway across Luton, Central Bedfordshire and Bedford Borough, bringing their pathways together. That so far has focused on mapping out their universal offer around the NDD pathway and looking where that can be strengthened to avoid the postcode lottery with those different areas, but also where families are looking for a little bit more support to make sure that that pathway wraps around the child and it's not just a sort of in one end and out the other, or halfway along the pathway, whatever that child's experience is. That's an ongoing piece of work which we're hoping to continue and develop something really solid from that. We've done a couple of different reviews of training strategies and policies for local areas, so that's been a bit more desk-based work. We've been did some in-depth work with Tower Hamlets, which involved some focus to supplement that review of the strategies and policies, and just to sort of identify how well they are progressing towards fully implementing the SEND reforms. And I'm going to be doing something similar in Newham in a couple of weeks' time. We've also did some training documentation reviews for Dorset, looking at their graduated approach and the training available to practitioners who are supporting children at that second level of intervention. We've done a couple of peer challenge reviews where we've been asked to support on those. So some really, really in-depth work there, which I suppose is sort of the next step on from those strategy and policy reviews. So it's been a very varied picture, which means that we've learned an awful lot from it. And once all this work is finished, we will be writing up some sort of summary of what we've been doing and sharing that learning. And part of what these webinars are for is to share that learning a little bit more widely. So the February and March ones will be picking up on some of the learning from these. I probably mentioned most of these things, but I'll just to summarise what we've learned overall from our bespoke support. None of you are alone. Whatever challenges you're facing in your role, whatever it may be, there are other people out there who have the same issues. I'm sure it can feel quite isolating when you want to be doing the best for children and young people in your local area, and there are all these barriers. But do remind yourself that all local areas have their own challenges, and many of them are shared. We know that the financial pressures are still very high. We know that the funding is problematic. Again, that's shared across the piece. We've mentioned staff turnover, so I won't go into that again. Something worth mentioning for the strategic outcomes angle, every time we go and do one of the high-level strategic outcomes frameworks development days, someone says, I've seen this before, this is Every Child Matters again. And we always come back to them and say, it's not dissimilar, you're right. Things that children and families want from a happy and a fulfilling life haven't changed. But the key thing is that you in your local area have ownership of those outcomes, and it's for your children in your area, somewhere that can't be taken away from you. We also know there's an appetite for standardised EHC plans, templates. I believe that is under discussion. I'm not sure how much I'm allowed to say about that, but I think I can probably say watch this space. Summary of our learning from there, and as I say, we will be sharing some more examples and some more in-depth learning in future webinars. So moving on then to what you're here for today, which is a focus on JSNAs. I'm going to move through this relatively quickly because really the is Helen, as she's the one who's done this piece of work, but I'm just going to start with an overview of what we know makes a good JSNA, and then Helen can talk to you about the practicalities that Luton went through to put that into place. So JSNAs are interesting. I was talking to Christine Lenahan before we delivered the London JSNAs, and she said to me that 10 years ago JSNAs were all the rage, and then they suddenly went a bit quiet and people are starting to pick them up again. And I think it's because of this focus on data and this focus on outcomes that JSNAs have an overlap there. And what we need to remind ourselves is what the purpose of a JSNA is. And you have here an extract from the statutory guidance, which emphasises that there is no mandate, there's no template, there's no format. But what we need to remind ourselves is that it is a tool for commissioning. It is how we understand our population, and understand their needs, and therefore what should be the actions that should be taken to support that population. They're not an end in themselves. They shouldn't be a dusty document put on a shelf. They should be live and working and ongoing, and we'll talk a little bit about how we can achieve that. This is a list from the article in NHS Confederation about what they think makes a good JSNA. This is a little bit more of the practical things, the side that need to go into developing one. So learning from the past, improving on what's already there, learning from others, being clear about what the scope and the mandate is before you go into one, because I would imagine they can be sprawling. In fact, I don't imagine, I've seen them, they can be sprawling. So clearly defining what it is you are and aren't going to look at in your JSNA. Point 3, this is an interesting one about target audience. The JSNA should be an accessible document, not just for strategic staff, but also for other stakeholders, including families, and thinking about what those different people who are using it want from this JSNA. What does that document have in it for them? Which comes back to our living document, working document point, and it not being a sort of in-depth piece of really academic research, but it is a useful, accessible document. We hear this a lot about building trust and shared processes. Co-production is the key word of the SEND reforms. So this is a document that should bring people around the table to develop, and that should be parent carers, children and young people, in whatever format that might look like. But it's a document that there should be shared ownership. Point 5, match form to function. That comes back to point 3, really about target audience and requirement. What is the JSNA there to do, and what is the best way to do it? Given that we don't have a mandated template, we want to be sure that the document is achieving what we set out to do. And again, that's about being a useful tool for commissioning and not just an in-depth piece of research. Number 6, secure capacity, skills, data and knowledge. But making sure that you have the right people working on the team around the JSNA, and that you are able to access the information that you need. I'm going to come back to this in a moment about what you need versus what you have. We're all swimming in data, and there's a distinction to be made about what's easily accessible and actually what is most useful for developing this commissioning tool. And number 7, governance of the JSNA process and products. That's thinking about timelines, when is it going to be refreshed, who has ownership of it, who has accountability for it, and ensuring that it doesn't get lost or subsumed, because they really are when they're being used well. Okay, so this is a little bit more of a summary from that Confed article. We've covered most of this already. We know co-production is key. You want a really solid evidence base that draws on both quantitative and qualitative data, which does require direct engagement to get the perspectives of those families and the children and young people. Attention to specific vulnerable groups. Now, this article is sort of talking about JSNAs in the main. We're talking specifically about JSNAs that focus on the SEND population, ensuring that you're reaching those children and young people. Again, we mentioned here direct engagement and focusing on those. I have read some where there are no mention of children and young people with SEND, which is deeply worrying. So making sure that you do have a specific focus on them is crucial. The really key point is that it's an assessment of current and future health and social care needs. It's not just a snapshot of who have we got now, but it's also thinking about where might they be, where might we be in the future. If you can project trajectories, you should be able to, and I from my desk and not from the perspective that you're working from, but you should be able to look at the horizon scanning and not just firefighting, thinking if we know where these children are now, where are they going to be in a year, 5 years, 10 years, and what does that mean for our commissioning? And it mentions here, this is a quote from this NHS Confed article, upstream prevention of ill health, but of course we're not just talking about health, we're talking more broadly, but it's thinking about early intervention and preventing crisis. A really key thing is having a timescale for review. Quite a lot of the ones that I've looked at have been reviewed in have last looked at 2015, 2017, whatever, and we're not quite sure when they're going to be. So it is a live working document, and you do want to make sure that your data reflects the children and young people who you're currently supporting. So those are the crucial ingredients from NHS Confed's perspective, and they've also mentioned here useful ingredients, collaboration with neighbours, learning from either geographic or statistical neighbours, and evidence of service outcomes. I've actually not sure I've ever seen this in a JSNA. So if you have one that does have this, I would love to hear about it. These slides are from the London event, so I'm actually going to gloss over Tower Hamlets as we have Helen instead to talk about Luton. I do want to quickly mention the overlap between JSNA and outcomes data. So I've talked a little bit already about those high-level outcomes, the be safe, be happy, be healthy, as an example drawn from Hertfordshire. But there is a clear overlap between your JSNA and your outcomes data. Both of those of work want to find out who lives here, who are the children that we have, who are we supporting, what is their life like currently, what does their future look like on its current trajectory, and what can we do to improve this trajectory. So that's coming back to that point just now about the current and future needs, looking at where we in the next 1, 5, 10 years time, and then what can we do to improve that? How can we make sure that our children and young people are achieving the best outcomes? So the data that you gather for your JSNA is the sort of the where are we now, and then that should tie in quite neatly with your outcome and think about what we want for our children and young people. There's not just an overlap between the data for both of them, but there's also an overlap between the professionals involved. So it doesn't necessarily need to be 2 pieces of work. You are no doubt already doing data collection that can be used for both, and save yourself a little bit of effort in that way. I've written here the major difference is a focus on SEND, but of course that may not be true if you have SEND specific outcomes and a SEND specific JSNA. That's one of those things that will vary depending on how you work on these pieces of work in your local area. What we found from the London regional event was that the SEND inspections, or indeed other reviews, have been a trigger for a JSNA refresh. A lot of people had said they sort of hadn't really done anything on it until somebody mentioned that it wasn't very good, or that another piece of work overlapped with it, so they brought it out and had a refresh. Similarly, a review of other strategies. You might do a piece of work that actually is very much like a JSNA, it just hasn't been called that. So be aware of what's going on and avoiding duplication, and where you draw some other pieces of work. The most common challenges is that the data is often too out of date to be useful. So you may have a snapshot of children and young people in your area, but it may have been from 4 or 5 years ago. I have seen one that hasn't been refreshed since the SEND reforms, so obviously it's still referencing statements and things like that. It's likely to be not the most useful document in terms of commissioning. Or sometimes there's no SEND focus at all, as it's not mandated, and there's not a specific list of the different vulnerable groups that you should be considering. It may be that there is no specific document and those children are being lost. I've been doing a piece of work, as I mentioned earlier, for the East of England. This is instead of their regional event, they wanted a review of their JSNAs. Apologies again if this is news to you. If you are one of those local areas whose JSNA I have been reading, you will get a sort of formal response in the next, hopefully next few days. There's some really good practice out there. A lot of people are looking at the 0 to 25 age range in line with the Children and Families Act SEND reforms. Really good JSNAs acknowledge how vulnerabilities intersect. They acknowledge that there is a gender issue, or that children from BME backgrounds experience disability in different ways, socioeconomic factors, all of those kinds of things. They're seeing how they tie in the bigger picture and not just looking at children with disabilities as children with disabilities, but as more complex families. The best JSNAs have a really broad stakeholder engagement, which includes children, young people and their families, as well as a range of practitioners. and they draw on for a wide range of quantitative and qualitative data sources, which you can't get that qualitative data without the direct engagement with families. Those that are really strong also acknowledge that there are gaps in their data and think about how they will improve on this for the future. We know that data is a challenge, as I've already mentioned, so thinking about how that can be plugged shows that it is a live working document and there's consideration for improvement. Going on from talking about a working document, the best ones have been recently refreshed, so we know that data is up to date and useful. They've thought about when it's next going to be refreshed, but most importantly, it's really linked in with other policies, strategies and programs of work. Really crucial thing for the document being live, in that it's not a standalone thing. It knows how other documents impact on it and how it impacts on other pieces of work, and that ties in with this need for clear and specific recommendations for action. A really good JSNA and Helen's, and it's an example of this, says this is what we know, therefore this is the recommendation of action, and this is a piece of work that can carry that forward. So there's a really clear link there between where we are, where we want to be, and how we're going to get there. For development, there are not many shining examples of JSNAs out there that I've seen. I may be wrong, and again, do shout about yours if you're feeling particularly proud of it. Quite often the so what factor is missing. This is the key part of a JSNA. It's not just a description of the data and a description of the children and young people in your area, but what does that mean? This is what we know about it. So what should we do? What is the implications for commissioning? What are the implications for action? And we quite often see this. There are a lot of focus on comparisons with geographic or statistical neighbourhoods or the national picture. So what? We must ask ourselves of this data. What does that mean for me? What does that mean for different people at a strategic or operational level? I've already mentioned that the evidence base is quite often what we know rather than what we need to find out. I've said that there's an awful lot of data out there. We shouldn't just be clutching at the closest, the quickest things, but thinking actually, what do we want to understand about the children and young people in this area? What is going to help us to support our commissioning decisions? We quite often see a focus on diagnosis or the services access rather than need. So we have numbers of young people who have an ASD diagnosis, for example, but that doesn't actually tell us what those young people need. One child with ASD will live a very, very different life to another. And what we need to understand is actually, so what support do they need? What services do they require? And what do we need to do to improve our community? I've already mentioned that there's little attention given to future needs. Not many people are projecting, some do sort of projections of numbers, but I'm not seeing people really thinking about what does that mean for our commissioning down the line. And it's not always clear what SEND means in the document. Mental health is a good example of this. Some documents talk about children with mental health. Really good ones recognise that children with SEND are at higher risk of mental ill health, and also recognise that mental ill health in itself can be a disability, but it's not always clear in documents whether they're making that consideration. Are they thinking about children with dyspraxia? Are they thinking about children with dyslexia? Where are these children being captured if not in the SEND document? And how do they interact with other documents, for example, JSNAs, which focus on mental health? That was a very bit of a whistle. I was going to pause for questions, but I think I will let Helen go and we can take questions at the end. If you do have questions as we're going through, jot them in the chat box, and Marie will pick them up. And any that we don't get to in this session, I can follow by email. So now if I'm using my bit of kit correctly, I should be able to pass the mic over to Helen. Helen, are you there? Helen? Oh, hold on. Sorry, no. Let's see if we've... Helen, I think I had on you. Have we got
Hello.
you now?
Yes,
There we go.
I'm on. Yes,
There
you
we
have.
go.
Yes, that's great. Thanks ever so much, Philippa. Shall I just launch into it?
Please do.
Yep. Okay. So I'm Helen Vincent, and I'm Senior Intelligence Analyst for Luton Council, and I have responsibility for I have responsibility for public health intelligence, and I often work on needs assessments. If you just want to go to slide 2. So I've been working on needs assessments for 3 years, and this piece of work that we did was completely different. It was a speech language communication needs assessment. It was much more successful and much more enjoyable to work on. And just listening to Philippa talking, actually I was thinking, oh, did we do that? Did we do that? And a lot of things I think we did. But what I'm going to talk about today isn't the assessment that we did. That's available for you, but it's about my experience of working on it and why it was different on this needs assessment compared to others I've worked on. So there was a number of reasons for this, which I'm going to talk about, but the single most important factor was that we had a designated project lead. So rather than this being tagged onto someone's day job, and the reason for this was because we'd had funding from the DfE through their Early Outcomes Fund. The aim of the funding is to narrow the word gap in young children as part of the social mobility strategy. And in Luton, the programme of activity was branded as Talking Takes Off. And this capitalised on our status as an airport town and the previous success in Luton of the Flying Start brand for Luton early years. Luton's used the DfE funding to make a systems change and is committed to providing a coordinated needs-based response to identified communication difficulties. The speech language communication needs assessment that I worked on was an essential part of that, bringing together information about needs and resources to help determine future activity. So we've just got the lovely Nadia Hussain on there, who is from Luton, and we managed to engage with the support of a couple of sort of celebrities to help us launch the Talking Takes Off brand. If we can just go on to slide 3. So the method that we used was standard needs assessment methodology, and every project that I've worked on over the last 3 years has taken a similar approach, but lack of time, buy-in and leadership have been notable barriers. People throughout the organisation who should have a vested interest are often busy and often overstretched. So let alone leadership, but even requests for data and information always seem to go to the bottom of the pile. So this slide captures the overarching factors that made this piece of work different for us. I'll be going into more detail, but the project was properly resourced from the outset with a clear understanding that the analysis was only part of the project and that other people had a major part to play to ensure that the assessment did what it said on the tin and was fit for purpose. Okay, so the next slide. Stephanie Cash was designated as the Early Outcomes Fund project lead. She was responsible for a number of work streams, which included the needs assessment. And I can't stress enough how important it was to have that project lead. And having her ensured that the final document was meaningful and useful. She had an idea of what she wanted to get from the needs assessment, and it also mattered to her that we did a good job. She also understood that it should be a collaborative approach and that we needed to harness knowledge and data from various parts of the council and the wider partnership organisations. And the individual that Steph was, she had sufficient respect from other people and the authority to bring people together and to hold people to account to ensure that everyone played their part. The next slide. So good analytical resources. And again, this was due to the funding. I was assigned as the analytical lead and there were 2 other analysts involved. Under normal circumstances, I would be allocated a needs assessment project, and in reality what would end up happening would be I would be responsible for driving it forward, I would be responsible for making the contacts, for arranging and conducting interviews, mapping the services, chasing and obtaining the data, as well as doing the analysis. So it felt like a real luxury to have the time to focus on the analysis and what the data was telling us. And although we were working at pace and completed quite a lot in tight timescales, it was just really important to have that time to do it. The analytical team also had a breadth of experience because there was more than one of us. There was different skills and working styles. Sarah is an early years specialist. Situl, who was the main analyst, had a background in the private sector and also housing analysis. And I 3 years ago, I came from a police intelligence background, and that meant that I'm particularly experienced in. I've gone off my little script, so I'll come back to that perhaps. But I'm particularly experienced in pulling together different pieces of intelligence to tell a story and to show which bits of that story matters. And what I was trying to say a minute ago is that actually, when you're looking at need, that's really important, because it's not a simple picture, it's quite complex. But then once you've looked at the complexity, you have to sort of simplify what you know from it. So this skill, this background, helped me to pull together the analysis that the team had conducted and weave it into a coherent structure. And also the fact that we had such a range of analytical experience, it meant it was a much more rounded assessment than I could have done by myself. Data is never perfect, but the collaborative approach supported by the project lead meant that we did obtain enough data from different sources to ensure that we had the best understanding that we could manage in the timescales we had. Data is always a problem, and we did highlight that at the end as our intelligence gaps. So slide 6. My screen has gone off, so I'm trusting that you've got one in front of you saying expert input. The needs assessment was launched with a widely attended workshop where we explained the needs assessment approach and asked for the data we needed. We were clear from the outset that the analytical team were not responsible for the whole project and that provision of data was essential for its success. We also made it clear that the assessment actually needed to do something and make a difference to how we work and the systems that we work within. And slide 7. I'm just going to put my screen back on. Excuse me a minute.
I think we're keeping up with you, Helen.
Sorry, it's the hard one. I'm not sure where you are. That's great. Okay. So quality assurance of the document was driven by the project lead, who ensured that what I consider a very vital function was carried out effectively. And she did it very well, and the process was sometimes painful but very much worth it. So practitioners read sections of it, they provided feedback and we responded or made changes. Then they read the whole document and we responded or made changes. Then service managers and directors read it and also provided feedback. So Steph managed the process, encouraging everyone to have a say, and as a result there was a feeling of shared ownership of the final product. And the process ended as it had begun, with a workshop which was well attended by key stakeholders, and the recommendations were developed from the themes that had emerged from the needs assessment. So we drew out the key findings, and at this workshop we presented the key findings and people decided on the recommendations. And I think that's one reason that it worked particularly well. And again, this collaborative process led to a sense of buy-in and shared ownership. So slide 8. And despite everything I've said, so slide 8, so everything I've talked about is processes, but slide 8 is about the people. And actually, it was another key ingredient that actually the personal characteristics of the people working on it were just spot on, and the analytical team worked very hard. The analysts working with me demonstrated they'd gone out of their comfort zone, so a willingness to learn and grow. And for me, it was actually the best experience I've ever had of team working. And it was also great working with people in education and early years who carry with them a sense of enthusiasm and commitment to improving the lives of Luton children. Throughout the project, there was a general mood of enthusiasm and optimism that meant despite the hard work, actually, it was a really enjoyable experience. And slide 9 is just a little quote from Sittle, who was the main analyst working on the needs assessment. And when I asked her for some feedback for this presentation, and her response there that's on the screen just reflects my own views, but also highlights that, you know, a piece of work done well is not just good for the organisation, but it's good for the people working on it as well. And it was personally empowering and rewarding for Sittle. The next page is, I'm not going to try and explain this, it's in the needs assessment, but we produced a full version and a summary version, and we also managed to whittle it down so that all the key information is on a single page. And this is framed around the need to understand this issue in terms of universal targeted and specialist speech and language provision. And this slide might look like it could have been put together in a day or so, but it's the end result of a very detailed exploration of a complex issue, and in a way is testament to the work that we did. And similarly, I think so. Sorry. So slide 11. I also got some feedback from Steph, and these were the things she talked about. But the topic hadn't previously been included in the JSNA. There was a JSNA done in 2015. It wasn't in there, so it was completely new ground for Luton. We had 3 months to complete it, which we managed to do, and this meant it was ready in time to inform the decisions that the project lead Steph had to make. And it drove the new strategy and the systems change. The tight timescales that we had were due to the fact that the wider early outcomes framework project was moving at a pace, but the needs assessment was ready to inform the training that across different sectors and planning of the new pathways, which there's just the final slide really is just showing the new pathways, which again I'm not going to try and explain, but I make the point that it was the in-depth understanding of the issue in the needs assessment that allowed for this pathway slide that looks relatively simple, and actually a further simplified version has been created for parents and other members of the public as well. So on the very final slide, there's just some contact details for myself and Steph, and just to sort of round up, you know, what I've said really, the key ingredients were leadership, team working, and the exploration and then the simplification of some quite complex ideas. So that's it from me. Thank you.
Thank you so much, Helen. I'm going to use the word enjoyed. I really enjoyed reading the JSNA that you put together. It is a good example of how you tie in the understanding our population to what do we need to do to support them. So I do recommend that all of you listening to this follow up with that and have a look at it. And I will share links around after this webinar. We've a couple of minutes left. Does anybody have any questions either for me or for Helen on any of the things that we've rushed through in this jam-packed hour? Just pop them in your chat box if you have, or indeed follow up with either of us afterwards. Doesn't look like it. Okay. As I said, I will contact you all. Make sure you have my contact details. And I can share the slides. Helen, are you happy for me to share your slides?
Oh yes, definitely. Just to say as well that for the actual needs assessment, we've got a slightly updated version, which I'll share with you.
Oh, brilliant. Okay. And this webinar on the whole has been recorded, so do feel free to share it with your with contacts, with colleagues. I will share the link to that as well, as you find it useful. and I will follow up with more details about the remaining 2 webinars. As I said, they will be end of February and end of March. One of them certainly looking at outcomes-based commissioning with James Brown from Stockport, the other TBC, but again, yeah, more learning from this DBOT contract. Please do drop me an email if you have any questions about anything related to this in particular or DBOT in general. And thank you for your attention, and I hope this has been useful. Thanks very much, and enjoy the rest of your day. Bye.
Thanks, Philippa. Bye.